Okay, welcome to our discussion about dental hygiene and becoming a dental hygienist. And Nick, I'm going to ask you to introduce yourself and tell us a little bit about yourself and your career in dental hygiene.
All right, thank you. My name is Nick. I am a dental hygienist. I have been practicing now for 2.5 years. I have to think about that for a minute. Um, I like my career so far. It's good. There's many things that guided me towards this career. I had zero thoughts of being a dental hygienist. 5 years ago, I would not see myself doing this as a career. But so far, I have no complaints.
That's great. That's great. What made you interested in dental hygiene? What turned the corner for you?
Um, I was working as a vet tech at the time, and I just really enjoyed doing dental cleanings on cats and dogs. I was actually working as a vet tech just to make money while going to college. I was going to college for glass blowing at the time, which was not something that I saw myself doing as a professional, but it was something to use up my money with my GI Bill. So I was really happy to I was basically just cleaning teeth. I was talking to the veterinarian I worked with at the time, and he said, if you like doing this so much, you could do it on people and make a good career out of it and make good money. So I'd be lying if I didn't say finances and money wasn't the large attraction to the career. I didn't really know too much. I hadn't been to the dentist since boot camp. And at this time, it's probably 2014. So I haven't been to the dentist at this time in my life since 2008, maybe. So I wasn't 100% sure exactly the ins and outs of what a dental hygienist was, with the exception of I knew I was going to clean teeth and that my paychecks would be decent. And that was it, really.
Great. What do you find the most satisfying aspects about dental hygiene career?
Patient education. I really have fine-tuned my delivery of oral conditions and talking with patients and kind of connecting the dots between where they are currently with their, oral conditions and what we can do to adjust certain things to then have great outcomes. I love to see my patients that come in and haven't been to the dentist in 10 plus years, because I was there. I was the same, situation where I didn't see dentistry as being nearly as important as it is. And it's such an important part of the entire body. So I just love to bring that information to my patients. And then when you see them a year later and you just see the complete turnaround of their mouth, is just unbelievable.
That's great. That's great. Do you feel that your education prepared you for the profession?
I would, without a doubt. I definitely think there are holes in any education program for any career that has nothing to do with it being dental hygiene specific. It's just you can't obtain all information in such a vigorous program where you're, expected to learn such a vast majority, like large amount of information, and you need to be proficient and you need to perfect and master that information. I don't see it being possible to do that in 2 years. So I don't think the education lacked at all. It's just impossible. But that's the great thing with continuing education in this career. You're constantly learning new techniques and new advances in technology to better your career as a professional and an individual. So yes, I think it would 100% prepared me, but I was excited to continue that journey and still learn more every day.
Great. And what are you required to be licensed in dental hygiene in New Jersey?
What do you mean? I don't know this question. Like what, like education wise?
Well, the tests you had to take and
Okay. Well, obviously you need to go to an accredited program and pass that program. And I think New Jersey, there was the jurisprudence test, a clinical exam, local anesthesia exam, and then two other written exams.
a national board.
National board and then the state one,
Right.
I think, right?
Yeah.
Yeah. Which were fine. Obviously it's stressful. Any large exam that's going to completely make or break your career, whether you're going to start your career next month or in 6 months when you retake the exam. That's stressful, and there's just no way to go around that. But I think my education prepared me tremendously. I studied on top of just going to school for the exam specifically. But I passed all of my exams, and I don't want to say little to no effort, but I was just prepared for the exam. I showed up, I took the test, went home, and felt confident.
Right, right. Was it easy to find a job after you were licensed?
100%. I fell into, and not everyone is this lucky, but I fell into a full-time position within 2 months of receiving my license. I kind of worked in different offices here and there, which there was plenty of opportunity to temp. I know hygienists today that I went to school with that still just temp every day, and they fill us 4 to 5 day a week schedule with zero problems, which I did that, and then I fell into a full-time position, which I'm still at, and I love the office. It was a great fit.
That's great. And salary and benefits, do you think you're compensated for, your efforts in the field?
Absolutely. Coming from a career prior to dental hygiene, and not even in the animal field requires a lot of work. But prior to that, the field of work that I was in, which was diesel mechanics, just required an obnoxious amount of work. And I make more money, and I sit in an air-conditioned office in a leather stool, and kind of just talk with patients all day. And if I have 45 minutes to an hour with a patient, I would say 30 minutes of that is just talking with them. And the rest of the time is maybe 15, 20 minutes of in their mouth. And I like that. I really feel like I kind of more go to work, and it's a little bit of work and more of a social club, which is neat. I think the compensation as far as hourly wage is phenomenal. I like that. I have not found many private practices that offer good benefits. That is one thing I wish there was a better result for, but there's not. It's just hard for a private practice to take that cost out and pay for half of the cost of benefits. There's a lot of corporate positions that I've seen out there, and I've seen a lot more in the past 2 years than when I first got my license. The corporate companies, they have the backing to offer fantastic benefits. So me personally, I just don't get the benefits that I wish I had, as far as like medical coverage, 401k, but they're out there and they're available. So if that's something that someone's really looking for, I don't think it would be a difficult thing to find.
Great, great. What opportunities are in the field for advancement?
Just like any other career, I really think dental hygiene is what you make it. There are an amazing amount of different avenues that you can go to, whether you're working clinical and you want to be in a private practice and just do basic, general dentistry. But then you could work at endodontist, ortho, or a oral surgeon, which is just going to be a completely different part of your, clinical setting. But you could get into research, teaching, obviously. There's other avenues as well. You don't have to just stay in dental hygiene. That education is, in my opinion, you're in the medical field. If you wanted to get into managing a practice, I don't see why a hygienist would not be qualified to do that. Myself, I plan on getting into United States Public Health Service, which that's going to answer my call for my benefits in retirement, which is my big push for that. But last time I talked to a commissioned officer that was with USPHS, she was in her 16th year, and she didn't work clinically anymore. She actually manages a veterans hospital. I believe she's in Delaware now, and she is the #1 girl in charge and runs that entire hospital, which then if she gets out in 4 years, she can translate that and go manage a hospital somewhere, which is crazy. That's amazing. So I think that there's a lot of avenues, and there's a lot of things that are kind of not as obvious for a dental hygienist, but it is what you make it. There's plenty of education. There's not just associates, there's bachelor's, there's even master programs now for dental hygiene, which is something I've been looking into, where expanded function. You could do basic fillings, extractions of deciduous teeth, stuff like that in certain states, possibly even own some practices in some states. So I think there's a lot.
That's great. That's great. It keeps changing, doesn't it?
Yeah. And more to say, it's what you make it. There's dental hygiene associations. You get involved in that, and you can start pushing in your state to adopt these advanced functions that other states have that are being very successful.
Right, right. That's great. Great advice. Speaking of advice, what advice would you give someone who wanted to get into dental hygiene?
Just do it. You're gonna have to put a lot of work in, and know that. But if it's something that you're interested in, I 100% would say go for it. It is a rewarding, very great career, and just put the work in and do it.
Yeah. What do you think, what attributes would somebody or characteristics would somebody have to make a good dental hygienist?
You have to know how to work with people. I don't want to say you have to like people, because I don't think I really like people. But you have to know how to, within 1 minute of knowing someone, how to talk with them, how to hold a conversation with them. And that is the key. As I'm presenting treatment plans or discussing a patient's, current oral condition, I have to quickly understand their perception of oral health, the importance of oral health, and where they value themselves, not just their mouth, but their entire self. And I have to take that into consideration before I bombard them with information. Some patients you have to go slower. Some patients want it right up front and go from the bat. So I think the most important thing for a dental hygienist is having the ability to work with people, read people, and understand them, and then go forth with that. I don't think you need to be a people person. My best friend in the dental hygiene school is a very shy, timid person, and she does great in this career because she puts that aside and reads people and has a conversation with them. And that's, I think, the main thing is of a hygienist.
That's great. That's great advice.
The mouth is a very intimate, private part of the body, and we are literally placing someone on their back and having them open up their mouth. That's scary for anyone. And you have to,
they have to trust you.
Right. Yeah. And to gain that trust, you have to read them, and you have to, know how to conduct yourself with them.
Exactly. And everybody's different,
Right.
That's it, there's no one size fits all, right?
No way.
Okay. So for our last question, if you were to do it all over again, would you? And how did choosing this profession impact your life?
If I were just to do it all over again, I would do it sooner. I wasted a lot of time coming out of the Navy, doing different career paths, figuring out what I wanted to do. I would have just done it sooner. I really wish I would have. And then the rest of it was, how did choosing this profession impact my life? Tremendously. I just wasn't sure what I wanted to do, and this gave me so many options, not just as a dental hygienist and working 9 to 5 in an office somewhere, but it has opened up doors that I would not have even thought of 10 years ago coming out of the Navy. What was I going to do? So I think, if anything, I would have just done this sooner.
Okay, that's great. Well, thank you so much for your time.
Absolutely.
And we
You're very
appreciate
welcome.
that. And we're happy that you're a dental hygienist and that you enjoy your career.
Yeah, thank you.
Okay.